We are going to talk about the future of health. And who is better to talk to than Stine Bosse, the Vice Chair of the Health Committee. Thank you so much that you are here.
Thank you very much.
We just released a report on preventive healthcare. We found out that not only in Sweden, but also in the other member states, we have a rather reactive approach to healthcare. And do we need a mindset shift to a preventive healthcare approach?
Indeed we do. And I mean, for many reasons. All the illnesses that we can prevent mean, first of all, a much higher quality of life. Because once you're ill, you are affected, even though we might be able to treat it. So that's first and foremost. A healthy citizen is a happy citizen. And then, of course, it's also a question of money. If we look at the aging population of Europe, then we will be facing real problems. We are already sort of entering into that period where, I mean, not everything is possible, but a lot is possible. So you can cure many diseases, many medicines that we can give to patients. And we have this aging population that will need a lot of medicine.
Yes.
So the longer we stay away from the doctor, the better.
Yes, I totally agree. And also in our report, we found out, happily, we are all getting older.
Yeah.
But the last 10, 15 years of our life are not healthier, but they are pretty destructive.
Sure. Sure.
And what do you think are concrete measures to change that?
I mean, I'm getting into the stage of life where I think a lot about this. I'm 65, so I am actually thinking a lot about, you know, how is the next phase of my life? How does that actually look? So I am more conscious about what I eat. I'm more conscious about exercising. I'm more conscious about, to the extent possible, not to have too much stress in my life. So all these areas where we know that we can actually do something. And of course, first and foremost, it's many years since I smoked. So some of the things we can just stop.
Yes, maybe you can help me with that one, because I transitioned to vaping and I'm trying to quit as well, but maybe you will give me some insights how to do so. But you just mentioned you are exercising.
Yes.
And
Eating more consciously.
Eating more consciously.
Yeah.
And also in our report, we are seeing that most of the diseases, over 80% of the diseases, are lifestyle diseases.
Yes.
So do we need also a change to a better lifestyle preventive approach?
Yes. And now I'm going to say something that might be to some people a little controversial, but we also have to look at how much meat we eat, how many vegetables we eat. So the composition of our plate is really, really important. So if we have a basic, healthy, nourishing diet, then it is okay to have an ice cream. Then it is okay to have a piece of chocolate. But if you eat wrong, you know, the composition, the basic composition
Yes.
is not right, then everything sort of piles up in the wrong direction.
And especially in those cases, for example, prevention, diagnostics, but also helping how to eat good foods, so that you then can eat some chocolate.
Yeah.
That we also like. Oftentimes, private initiatives
Yes.
are doing a lot.
Yes.
What do you think? What role private initiatives and/or public-private partnerships should play?
Well, I'm a strong believer that we actually need to be acting in many areas here. First of all, yes, the private initiatives, and they are out there, and they will help us and suggest things to us. Then I think also at the other end, I do think that also a public opinion, you know, you could even say it's from the taxpayers. We pay into this area altogether, and we should also from that contribute by having pieces of good advice. Why not? Because it is good for us, it is healthy. And then everything in between, where you work with something that is private and it's public and it works together and it actually makes sure that we, and it is stick and carrot. So something is actually to say this is a bad idea, and the carrot is of course to, for example, in Denmark, we're talking about now lowering the VAT on food and taking it completely away on vegetables and fruit. And that is a way to nudge the population in a certain direction. And I think that is extremely important.
Yeah. I also discussed with MEP Andriukaitis about our report, and he said, yes, we need a implemented preventive healthcare strategy, and private initiatives also need to be at the table.
Yeah.
What do you think about his proposal?
No, I think it's a great idea, and I do think that we need to think collectively about this. I'll give you an example that is interesting. If you compare Denmark, my home country, to Greece, where I come often, now we all know that the healthcare systems in the two countries are very different. Many people would say that the Danish healthcare system is extremely good. And I would say, to some extent, yes, we can also do better. But definitely it is better than the Greek, even though the Greek system is getting better. Mm. The Greek population smokes double as much as the Danish population. Mm. And we have the same longevity. How can that be?
Yeah.
And that sort of thing we need to study. That is about the diet, Mediterranean diet, and it's about the style of living. In Greece, you say siga, take it easy. In the Nordics, we're always running, we're always being efficient. Sometimes we have to cool down a bit. So what I'm very much for is everything that is in Andriukaitis' idea, but also to say benchmarking. Let's learn from each other.
Yes, I completely agree. And also this making people aware how important your lifestyle is, and the numbers that you just showed, it's crazy. On one side, smoking a lot, and then Denmark,
I'm not trying to promote smoking.
No, I understand, but you are trying to promote how important the lifestyle, food, exercises, being more educated. What do you think? Maybe we go because you touched the topic with smoking. So we are Brussels based, but we are also Stockholm based. Yeah. And Swedish MEPs are very proud that we are the first smoke-free country in Europe, and that we have numbers below 5% smoking. Yeah. But one of the strategies why it is working is because we have also a harm reduction strategy. That means that nicotine pouches are taxed lower than traditional smoking.
I must say I'm not an expert on this, but I do question. You said it yourself. You quit smoking and now you're vaping, right?
Yes, true.
So you're still addicted to the nicotine.
True.
And nicotine is not the thing that your body really wants, especially your heart. So we're still in an issue, right? And that is where I'm a little reluctant to say that this is a brilliant strategy. I mean, I have all the admiration for my Swedish colleagues. We call ourselves brothers and sisters in the Nordics. But I would question, is this really a long-term strategy? And then what is the next idea to get people off these products? Because they're not healthy. They might be less unhealthy, but that I would like to see. Again, I'm not a specialist, but I want to see the strategy to then take it the full way.
Yes, I'm also not a specialist, but I also talked with MEP Tomislav Sokol on this issue, and Mr. Sokol said, listen, those nicotine alternatives can be part of the solution for long-term smokers, for example, to get rid of the traditional smoking.
Yes, but, and there's for me a huge but, I'll have to be open and transparent. I don't meet with the tobacco industry
Yes,
at all.
yes.
Because they now make these products. They make it taste like candy. They make it taste like fruit. They make it taste delicious. And they do adverts that are appealing to young people, even children. And that for me is like, no way. I can see the idea if it is a prescription, you're addicted to smoking, there is a way out and you have this vaping model, you do it for a year and then you sort of go down, fine. But the way it is now orchestrated by the industry, I'm afraid I'll have to say I don't buy in on that.
Yeah, because I'm also, I'm not a Swede, and I know in Sweden it's a very big topic because of snus, and it's
Exactly,
across all parties.
Sure.
Mostly all Swedish MEPs are, hey, what is happening? But there was, for example, a ban of nicotine pouches in France. What do you think about that?
But I think it's right. And I do find it important. I don't know if a ban is the right way, but I do find it extremely important. Again, benchmarking, let's see how that works in France. Does it actually take down the use? Does it reduce the health problems connected to this? Let's find out the right way, because what I do know is that we cannot look away from doing something, and preferably very efficient. We need healthy populations, also from the point of view that when we age, we should contribute still to the workforce. Otherwise, we're going to have serious social problems, right?
Yeah.
We won't be able to have the welfare system we have if we can't fund it with workforce and tax. So that's just
I also agree,
Yeah.
but I'm just trying to question if the Swedish way is not the better way than, for example, other countries who have way higher traditional smoking rates.
Well, look, I want to see the figures. So let's meet again, say 3 years from now, and compare.
Yeah.
Let's see how it works. How does the health situation develop? How does the addiction situation develop?
Yeah.
And how does the total cost develop?
Maybe meet today, because I think it was last week the FDA, the Food and Drug Agency in the US, they just reviewed an assessment study and said that the Swedish match, it's called SIN, nicotine pouches, that they can market it with the claim it is less harmful than traditional cigarettes. In particular, to strokes, lung cancer.
But look, that's probably good. That's
Yes.
probably, and I would underline probably, because I still want to know whether other problems will develop. So that's one. Second, then I want to be a total ban to sell these products to young people who have never smoked. They've never been close to a cigarette.
People, yes, I totally agree with you. People who are youth, who are under 18, 100%. And I'm also not seeing, because I'm using nicotine myself, so I know it is addictive, but so is alcohol as well. And we have there not the discussion of, okay,
No.
let's ban the alcohol, but the nicotine pouches that are having lower cardiovascular numbers in Sweden due to the lower traditional smoking. This is my question, couldn't that be a way? Or are your Swedish colleagues wrong?
No, I don't want to deem anybody wrong in this. I still think we are searching for right solutions. But I do question whether it is right to go down that road, especially because it's tempting young people. You know, I had a chauffeur when I was campaigning.
Yes.
And this young man, what would it be, 19, 20 years old?
Yeah.
He took 10 of these bags a day. Each of the bag held what is equivalent to the amount of nicotine of 10 cigarettes. That's 100 cigarettes nicotine he consumed every day. And he was addicted, and he knew very well he was addicted. So I want to see what are the long-term implications of this? How is that going to develop? And can we find a model where we protect the young people from going down this street at all?
Yes.
And then that's why I say might be by prescription. But why should I be able to go into a store and buy these products? I don't get that.
But we can buy, for example, cigarettes.
Sure.
We can buy them in Sweden. We are under 5%, 3.7 with smoking. And Swedish people are very proud of it. And now they are afraid, okay, our way of living is in danger in Europe.
I don't think there will be a total European ban. That I'm pretty sure of. But I do think that there should be, and I would encourage that, again, benchmarking, understanding how does this work in real populations, and how can we together find the real model to make sure that we help people who are addicted and who need to get off the smoking model.
Okay, let's help me.
Yeah.
Let's help me, because I was a traditional smoker. Now I'm using vapes. I want to go, and I'm considering to go, for example, to nicotine pouches. Yes, to make the next step of the transition. And then I get those mixed messages, like.
But then we have to pretend that I'm your doctor, and then I make a prescription for you. Then I say you can have your nicotine powders for 6 months, and then I do, an X-ray to your lungs. I do all the medicine, the medical tests that you need, your age, smoker, and then you come back 6 months, and then I check you.
But then I also have to say I'm once a month I'm also smoking still cigars.
But then
like
I
old
haven't
style.
helped you.
It's for me a luxury thing. It's for me like the chocolate. I'm trying. I'm doing sports, and but for example with nicotine pouches, I looked into it, and I know it's a big topic in Sweden. And there, if you look at the data, yes, I agree. We don't have many very long-term studies, but the short-term studies that we have are showing, okay, lung cancer, other diseases, especially throat cancer, the risks are lower. So this we already know from short-term studies. And my question is, what does the FDA in the US know that we don't? That they are saying, okay, we did our assessment, our study assessment, and we are saying, claim on your packaging it's less harmful than traditional
But you
smoking.
know what? I mean, if you were right in that conclusion, we should get rid of our own EMA, all our people in Europe that work in this area, they should just be dismissed, and we should just take everything from the US. That's not my model. I want the European population to be looked after and safe by measurements that stem from our research and from our intellectual work and our benchmarking. And I'm not saying that the Swedish model could never work, that it's wrong, whatever. I'm just saying, for me, it's too early, and I will not think this is a good idea until we have stopped the entry door. The entry door is being opened again and again by the industry because they make these wonderful child calling products.
I'm totally on your side on the protection of children who are under 18. This I also
So there you believe
see.
also a ban could be the right model, total ban.
I think that the same is for alcohol, that you can drink alcohol from a certain age, and that you also cannot take nicotine pouches when you are 13.
Or
This is
vaping
crazy.
or anything, yeah.
So there need to be youth protection.
Yeah.
I 100%
Yeah.
agree
Yeah.
with you. And still, because I'm debating also with my Swedish colleagues, if such if the Swedish way is not the right way, and if the commissioner, health commissioner, is saying till 2040 nicotine free, then I'm seeing, okay, yes, nicotine is addictive. So where am I going then to
But
a
look-
illicit or illegal market?
Our conversation is about health.
Yes,
And our conversation is about healthy lifestyle and
Yes.
longevity.
yes,
So if we want that, we want to think about what we eat,
Yes.
how much we exercise,
I completely agree
how
with
much
you.
alcohol we consume,
Yes,
that we don't consume nicotine because we don't need it. I mean, alcohol is some way also connected to, you know, the traditional lunch on Sundays where you will have a beer and a snaps and so on. So as long as you don't overdo it.
yes,
But the problem with smoking is it becomes an everyday habit very easily.
yeah.
And that takes you into vaping, that takes you on board, you know, powders and stuff. Why? We should try and get off that track.
But are you then saying that a moderate use of these products could be the
No,
right
because
way
I don't.
for...
I was a, you know, what would you call it? Party smoker. I only smoked when I was going out, and then
I envy you. Yes, I know.
But what
I know how
happened?
people.
This was after I had my children, where I obviously quit the day I knew I was pregnant, and then I said, "Oh,
Congratulations.
I can just have one cigarette." Hooked. That's how strong, and we all know nicotine is an extremely addictive.
Yes, and I'm not questioning that
No.
because I know it from my
Yeah.
own experience.
Yeah.
The only thing is I'm trying to find a way where I can also have a more moderate, like drinking a glass of wine once
look,
a
you-
week,
you-
and
Ask an addict for something else, heroin. You know, I just have a shot of heroin once in a while.
but why we have the discussion with nicotine pouches?
Because
and,
it's so addictive. That's the problem. Otherwise, you would just quit smoking. Full
Yes,
stop.
and I'm also not arguing that it's risk-free.
No.
I'm just questioning if there is a possibility to have something that is less harmful for me. And it's so weird that we have in this area such a debate. And if we are looking at sugar with chocolate, where we are saying, okay, yes, moderate
But look, this is why
alcohol.
I'm saying to you, I mean, chocolate is not as addictive as nicotine. Nicotine is really a hard chemical that you are addicted to pretty fast. Whereas a piece of chocolate, I guess, is not something that you can really be addicted to in the way that you must have it.
So what are you saying? Are you saying that the vision of the health commissioner to have till 2040 a nicotine society?
Nicotine free,
Free,
yeah.
yes.
I think that's a good vision.
So the Swedish model is the wrong model.
Again, I don't want to deem anything to my brothers and sisters in Sweden.
Yeah.
I just want to say we need to be more educated in this area, and we should do benchmarks. We should do healthcare checks to the people who have then been doing vaping for 10 years, 20 years. We don't know this yet because, you know, it's pretty new. The same goes with powders. Let's check it. Let's make sure that we don't get rid of one problem and create another problem. And again, if we think back to, you know, the financial issues, people, what do they spend their money on? how should I recommend to any citizen, how should you live, then I would say, honestly, spending money on nicotine might be necessary for you, but it is a bad idea. Spending money on healthy food, spending money on exercise, spending money on social activities. We didn't talk about that.
Yes.
Social activities are important.
Yes, 100%. We had also with Tomislav Sokol organized a small conference for young children and
Yeah.
how important social activities are
Yeah.
for those
Yeah.
young children
Yeah.
being in the hospital.
Sure.
And I totally agree with you. Healthcare, having a active lifestyle, which I have. So having an active lifestyle, eating well, and I can also see that you are also very active. So I see that you are implementing the exercises, the lifestyle, sport, and I guess that this can really help us.
And no nicotine, no cigarettes. I quit when I was 35. One day, stop. When my daughters wanted to hold my cigarette, I said, that's it for me.
And
Got to quit.
I completely agree with you. The way going away from smoking, because this is what I think is interesting about the Swedish model, that we managed to be the first smoke-free country in Europe. And now the next question for me is, okay, can I use less harmful nicotine products also in the future, knowing that nicotine is not risk-free.
But you put every time you want to buy your vapor. Is it called a vapor? I don't know. I'm not in that world.
I'm just
every time you buy the thing, or
Yes.
you buy whatever you put in it and so on.
Yes.
You put that money aside and you see how much you can save up during a year. It's a lot, and that you can go without. I'm completely sure. And I mean, you're a person with, you can take decisions, right?
Yes, of course.
Good.
Yes. Okay.
Okay.
Perfect. I'm so happy that we had the discussion about the future of
and
health.
I would be curious on this subject from now on.
Yes,
Even
me
more.
too, because it's following me all the time.
Yeah.
And let's do some sport,
We will do that.
eat well. Thank you so much.
Thank you.
Thanks.